Dear students, welcome back. In this session we are going to discuss about intracapsular ligaments of the knee. In the previous session we have discussed about extracapsular ligaments, isn't it? Yes. The intracapsular ligaments includes cruciate ligaments, transverse ligament, menisci, as well as the coronary ligaments. Okay. Now first we will discuss about the cruciate ligaments. This cruciate ligaments is of two in number. One is the anterior cruciate ligament and another one is the posterior cruciate ligament. And these cruciate ligaments are very thick and strong fibrous bands which act as direct bonds of union between the tibia and femur. Okay. To maintain antero-posterior stability. Okay, so these ligaments are named according to the attachment on the tibia. Okay, so this anterior cruciate ligament got the name because of this ligament which originates from the anterior aspect of the tibia, so it is getting anterior cruciate, whereas the posterior cruciate ligament which is getting originating from the posterior part of the tibia, so it is called as posterior cruciate ligament. Anterior cruciate ligament begins from the anterior part of the intercondylar area of the tibia and runs upwards and backwards. This is the anterior and posterior, isn't it? So runs upwards and backwards and laterally, and it is attached to the posterior part of the medial surface of lateral condyle of femur. Okay, and it is taut, that means it becomes tight during extension of the knee. Okay, now we will see the posterior cruciate ligament. The posterior cruciate ligament begins from the posterior part of the intercondylar area of the tibia, runs upwards and forwards and medially. So this posterior cruciate ligament attaches medially to the anterior part of the lateral surface of the medial condyle of the femur. It is taut during flexion. During flexion it becomes very tight. Okay, and these ligaments are supplied by the middle genicular vessels and nerves. So this is about the cruciate ligaments. Now we will see the transverse ligament. Okay, actually two semilunar cartilages which are present on the tibial condyles. One is called as lateral meniscus and medial meniscus, and this one also having anterior horns and posterior horns. Okay, if we see the transverse ligament, it lies within the capsule. It connects the anterior ends of the anterior ends of the medial and lateral semilunar cartilages. Okay, so medial and lateral semilunar cartilages. This is about the transverse ligament. Here you can find the cut end of anterior cruciate ligament here. So on the anterior aspect. So this will move like this. This will spread like this, cruciate. And this posterior cruciate ligament will come like this. Okay, so these are the attachments of the cruciate ligaments. Okay, yes, now we will move on to the next ligaments, that is called as coronary ligaments. Okay, coronary ligament. Here, so this one is a schematic representation for the coronary ligaments. So this coronary ligaments consists of short ligamentous fibers which serve to connect the peripheral convex margins of the semilunar cartilages. So here this is the meniscus below this one. Okay, so semilunar cartilages to the peripheral margins of the tibia. So to the peripheral margins of the tibia, and these fibers actually merge with the lower part of the capsule. Okay, this is called as coronary ligaments. So above this one you'll have the capsule, and then we'll find the extracapsular ligaments. Okay, so this will connect. So if we have, this is the meniscus, and here you'll have the tibia, isn't it? So the peripheral margins of the menisci is connected to the peripheral margins of the tibial condyles. So like that, and these fibers finally blend with the capsule of the knee joint. Okay, this is about the coronary ligaments. Now we'll move on to the menisci. Okay, so this menisci is also called as intracapsular ligaments. We will see in detail about this menisci in the next session. Thank you.